Hello guys, welcome to my channel. This is the 26th day after my double surgery. It's been almost 1 month, and today I'm not gonna talk about my recovery. I have to tell you that I did some advancement in terms of eating and so on. I ate pizza, but this is all I'm gonna say about my recovery, because today, as I promised in the past video, I'm going to do a Q&A about the questions I had before my double surgery, after the double surgery, and during this whole process. And also I'm going to reply some questions that you made me, because I think this is very useful, because you wonder about so many things, and you have so many doubts when you are going through a double surgery. And the fact that I had the same concerns, and you can have the information and give it to you, I think it can be a little bit useful and give you a little bit of relief as well. So I'm gonna start right now. By the way, this is the 6th time I record this video, and I hope I go quick, no one interrupts me. I put a paper on the door like the director is recording. So I hope I can reply to all these things and you find this useful. Anyway, if you have any other questions that I didn't go over it or whatever, you can DM me on Instagram through Micah Goodstone Jaw Surgery, or even pop the comment here, and I will try to reply the fastest I can. So let's go. First question, you made this question. So, did you have the support from your parents? No, first totally, but yes, right after. So what I did, I didn't talk to them until I had the tests and all the reports from the surgeon, the doctors, the orthodontists. I went already to the public and to the private system, like to have all the perspective and the possibilities covered. And once I had all this information, I went over to them and I explained them, look, I have sleep apnea, lower jaw protrusion, I have open bite, cross bite, and also I cannot breathe through my nose. I have my airflow obstructed by my bones. So the normal orthodontic treatment is not gonna solve this. What I need is double surgery or orthodontic surgery, and to help and to have the best result, I'm gonna need sharp surgery to have my occlusion right. And they went over the reports, and also I suggest you that if they can talk to the surgeon or the doctor themselves, this is gonna help a lot, because it's not your word, but it's a specialist, and the specialist, and in the end they are your parents. They fear for your health. They find this high risk, and at the beginning they don't think you need it. They think you're perfect, you're good as you are, and they want to avoid any kind of any kind of risk or this huge investment of time, money, and so on. So the fact that they could see the clinic, go with me, and have all these reports, this gave them a lot of peace of mind, and they support me more because of this. Anyway, you have to be very, very certain or very confident about your decision, because even the weeks before the surgery, my father was like, but are you sure, like, this is what if it goes wrong and you are worse after this than before? But you have to be confident that this is the good thing to do for you, and in the end they will stand by your side, because they want the best for you. And anyway, I know some cases that they didn't support the decision. They thought this didn't make sense or wasn't necessary. So, but in the end, I mean, it's your health, it's your life. So Sorry, the saliva like goes everywhere, you know, my problem right now. But anyway, and yeah, you have to choose. And if you really think that this is gonna make a change in your health and your quality life, so you choose in the end, I think. So next thing, what did they do to you, like exactly? So I'm going to go over the report that they gave me, like from the clinic, and there are some medical terminology, but I think it's gonna help a little bit. So they did bilateral sagittal osteotomy of mandibular advancement and counterclockwise rotation. So what does it mean? They cut it here, and they move it forward and counterclockwise. So this explains also why they didn't do the genioplasty in the end, because also when they rotate a little bit, it changes the proportions and it can make your face look shorter. So yes. Second thing, minimally invasive Lefort 1 maxillary osteotomy using the advanced twist technique. Reconstructions with hydroxyapatite block in interstitial bone defect. What does it mean? That they push this jaw forward, they cut it here as well, and they put a block in between. I thought they took a bone from my palate, but no, actually it was a hydroxyapatite block that they put it in between. Why? Because after the sharp surgery, apparently my bone didn't reconstruct totally itself, so it wasn't very stable. So they put it in between to avoid any kind of recession and to have more stability. Other things they did, it was turbinectomy or turbinate surgery, septoplasty, to, because sometimes the buccal breathers, as we are, so we have the septum deviated as well, and some problems that stops us from breathing through our nose. So they realized that I have my septum deviated, so they did all of that. And to finish with all this process, they did the extraction of the 38 and 48 molar, which are my lower wisdom teeth. Other things, these are the questions that I did to my orthodontist. So am I having some recession even though they put this block, or I feel that the teeth are moving? Yes, teeth may be moving a little bit, more in my case that I don't have braces or Invisalign right now. They removed the Invisalign before the surgery, and they told me that until the 4th week after the surgery, I wouldn't be able to have my Invisalign in because it has to heal. And right now I have nothing, so it's normal that teeth move a little bit, but because I have the rubber bands to fix the maxillars and the jaws and make that everything fixes in the right position, I shouldn't have any problem. And like she saw that the occlusion was totally right, everything fits just right. And also actually my orthodontist was quite surprised by the fact that my midline is in the center right now. He wasn't expecting that. He thought that she would have to straighten it a little bit more with orthodontic treatment, but actually my surgeon could do it. I have to tell you that there were a couple of days that I felt that the midline deviated a little bit, and I'm gonna show you one thing that affected in that. Together with this screw from the surgery, I have this that my orthodontist used before for the Invisalign. So there was 1 or 2 days that the rubber band went on to this. So this moved a little bit the pressure, or changed the pressure that was made to the jaw and not to the teeth, because well, in this case, yes, to the teeth. So after this, after I realized that I was doing this mistake, I paid a lot of attention, and this never happened to me again, and the midline is perfectly straight. Other thing, I asked about the implant, and she explained me what I told you before. And actually, she was very glad that he put that in between, because when it's so recent, or very little time went by from the surgery, or the time that actually, sorry, your bone didn't have time enough like to heal totally. It's better to have this. So my orthodontist was totally relieved, and that we don't have to worry about this. So sometimes I notice like some noise, when I chew, or movement on my teeth, and the orthodontist told me that this is totally normal. We've moved all the teeth around a lot after SARP and so on. So there is a little bit of a space in between the teeth and the roots, and a bit of swelling as well. So it's normal that they move slightly, and because they have a little bit of room there, but it's very frequent and not to worry about. More, are the gums healthy? So they are very pink, and she was very happy. They are healthier now than before. So one good thing about not having braces or Invisalign is that it's very easy now to wash them and to clean and so on. So yes, if you take very good care of them, and they can be like very, very good. More, frenectomy, do I need it? So I have to explain a little bit. There are two other causes. Well, there are many causes, but two that I consider like seriously, like for my sleep apnea, were the fact that my tonsils are very big. I cannot show you now. You can see in my Instagram, but they are very, very big, and stop a little bit the airflow. And also it's called the tongue tie. They solve it through a frenectomy, and what it causes is that the tongue cannot go up, and it goes back a little bit and obstruct the airflow. So I asked my orthodontist, and she was like, because I also explained her that I recorded after my sleep after the surgery, and my snoring rates went down like to 0 or 1 or 2 snores per night. And she was like, I think you don't need frenectomy or have the tonsils removed. This is something just to consider if after the whole recovery and so on you start to snore a lot more, and this is a concern for you, so you can look into that. Then, how many more months do we need for orthodontic treatment? She told me 6 of Invisalign. The normal situation for you is that you will need orthodontic treatment before the surgery, and then orthodontic treatment after the surgery. Normally, you go to the surgery with your braces, and then you have the rubber bands around the braces. But in my case, I went with Invisalign in the last period before the surgery, so I had to stop after the surgery, and then I will keep going. Maybe in a couple of months I will resume with my Invisalign. Some of you don't need, for example, if you had braces before, like in your early years, or when you were a child, you had braces, maybe you don't need right now because the teeth are well located. But in my case, I never had orthodontic treatment in my life, so this was very necessary to prepare the occlusion and to have, you know, the certainty on the collocation or the movement of the bones, and to have the certainty that the teeth, the occlusion was gonna be right in the end. But this is a normal situation that you would have braces or orthodontic treatment after the surgery to make sure that everything is in its place and fits perfectly. More questions. These are the questions to my surgeon. Do you think there can be recession having so much time without Invisalign? He told me like not to worry about, not to go crazy, and in 2 months or 1 month resume with Invisalign. Probability of infection, how to avoid it, how long do I have to use chlorhexidine, how up can I go, like brushing my teeth, can stitches go away and jump, and the possibility of rejection from the, you know, from the plates that will be placed. So they tell you that basically the mouth is a very good place to have a surgery because the saliva and it heals very fast. So this is a good thing, but you have to keep attention to your cleaning, like use the water pick, because at the beginning you're gonna have a toothbrush like for surgery. It's very soft that you cannot open your mouth a lot, so you're not gonna be able to brush it very well. So the water pick is gonna help you with all the spaces where you don't go and to help to removing the blood and everything. And also you will use chlorhexidine that avoids the infection. But chlorhexidine is only for the first week or 10 days. After 10 days, it will stay in your mouth and you don't really need it. So I stopped right then. And the other thing about the stitches and how up you can go, this is like common sense, like go up. I go like where the gums start and so on. I don't go crazy up. What I do is I put like the water pick, the water to go up and so on. But about the stitches, they go normally, they start to fall like the second week, the third week, and they told me to not worry because even I had some laugh attack and I was like, no, they are gonna go away, but they are very well placed and okay, you have to be careful, but they won't go away. And the probability of having infections on the plates and so on, normally this is made by a material that is biocompatible with your bones and so on, and normally it stays there forever. You don't have to take it out, at least the material, or in my surgery, in my clinic. But you have to pay attention to things like having fever or having bitter taste in your mouth or weird things, because this can happen, and you have to go on call straight away to your clinic or your doctor if this happen. But normally there shouldn't be any problem. What about the medicines and so on, and the antibiotics, as well as the the moisturizer or the cream for the swelling? So the antibiotics is for 1 whole week, if I'm not mistaken. Yes. After that, you just use like the painkillers when you need it. I stopped as well, I think, in the first week or the first 10 days. And the cream for the swelling, they tell you that you can stop the 7th or 10th when 10 days goes by. I still use this sometimes to help with the swelling to go down, but yeah, that's it. And when are we able to resume the Invisalign? He told me that in 3-4 weeks, but as I cannot open my mouth right now, I cannot keep going, so I think it will be the 2nd or 3rd month. Then about the food, when to eat soft food, hard, and so on. So they told me the first week I was on liquid diet. When I went to the first checkup, it was almost the first week, the 7th day, it was the 6th. They told me to go to soft food like pasta, rice, fish, and things like this, and it was fine. And then you start noticing like your body starts to accept like harder food. I went on to, I don't know, pizza, for example, the 3rd week. Last week I was eating tomato today, and a little bit of harder food, no like steak or things, hard food, but you will notice when you have pain or you feel like you shouldn't push it that hard. It's better that you go slowly. What about the sleeping on a side or doing exercise? Well, this 4th week and also the 3rd week, I started to sleep on a side, but not putting this side of the face, just the upper side of the head. But they tell you, in the first week, they told me that I already was able to sleep on a side, but I don't feel comfortable with doing so I go like very slowly. And about exercise, I do running, and this you cannot do until the 2nd month or so on, because the high impact sports are not good for this. So it's better like to do swimming, cycling, going for a walk, things like that, and take it slowly. I also was doing some squats and abs this week, like very carefully, not going crazy, like very very fast or putting pressure on my head, but just slowly. Also, can I drive? Yes, you can drive, but bear in mind something fact. Bear in mind that not putting your mouth, like shutting it very hard or with stress or so on. I have it relaxed or even slightly open, so I don't put pressure on it. Then how many millimeters advancement they did? What I read and I spoke with my nurse, it was written on the plate 6 millimeters. So I think it was to 6-7 millimeters advancement the upper jaw, and around 10-9 millimeters the lower jaw, but I don't know for sure. But this is the minimum. I will ask it. Then next stages and how often do I change my rubber bands. So next stages, in when it's 1 month, I go again to the checkup. So the first week, then the first month, and then they will tell me maybe when it's half a year or so on, and about the eating, like what I just told you, about the exercise as well, about cleaning very carefully, and as well they told me to use the rubber bands to change them every day and put it in a triangle shape, and this will help with that it is very stable in the position, and this doesn't deviate and gets consolidated right. Then more things that they told me, for example, the nurse to say very clearly what I want and what I don't want. For example, I said that I didn't want my nose to change, but surprise, it changed. When the upper jaw is moved, it moves the soft tissues, it gives support to it, so you may have a little bit more cheeks or your nose can go up. My nose is uplifted a little bit, but I think it went down already a little bit as the swelling is going down. But of course you tell them the surgeon, you tell him your concerns and what you want to achieve or what you don't. But in the end, I tell you by the experience of many patients as well, at least in my clinic, he does like what he considers, and this is bad and good. I mean, bad in the sense that you don't feel that you have the power like to choose totally. I didn't know what was gonna be done exactly until I had it done. So it gives you uncertainty a little bit. And also I know people who is not happy about the result because they were like, I don't want to have a big change in my face and so on. But then I think I prefer that I would be so pissed off if I would say like, no, I don't want this. I would say no to the surgeon, and I would stop him from doing the what he considers is the best, and that maybe in 1 year I would be like, no, he was right. So this can happen and make clear your point, but in the end, I guess we have to trust, at least this is my personal opinion, you have to trust the specialist, and if he takes a decision on doing or not doing something, as he did with the genioplasty, that he didn't do it in the end, maybe it's because it's the better for the case, it's the best thing to do with the case. So yeah, it really depends. More things. I asked him like, is this gonna help like to get my face right and to have my cheeks? So as I told you, it gives support to the soft tissues, and also they straighten my face a little bit. As I told you, the teeth were more deviated. Like now you can see in my previous videos, actually I freak out, like it's crazy how small was my occlusion and my upper teeth, and you could really see that I had open bite. I could barely close my mouth, and only these teeth were touching. And also about the inclination, or that my jaw was deviated a little bit to this side. So definitely they get it straight in during the surgery. This is one question. To be fair, I didn't talk too much about it, because I didn't want it to look very, very shallow. But if it's your concern, don't do it like me. The question I didn't do, it was, will I need cheek implants? And I didn't do it because of that, and also because my cheeks, normally when I smile, I like them, and I thought, wow, if they get my face shorter and also more cheeks, maybe I'm gonna look very round. So okay, let's let the specialist work. But yes, if you have that concern, just do it, because I know another case of a beautiful girl who told me that they told her to do a cheeks implant because of the, to give more proportion to the face and more support, and she said no, and now she regrets. So yes, speak better before than after. More things. Yeah, probability of infections, I already told you, and in doing a surgery or taking the plates off, normally they stay. And also another concern I had is that maybe if you cut too much here, because they compacted the upper jaw, maybe when I get older and this skin goes down, it's gonna cover my upper teeth too much. And yes, it will go down a little bit, but they just cut the necessary thing. They try to not cut as much, in the sense that then it covers all your upper teeth. So no, they do a balance. And then more things that I did, more questions I did to the surgeon. Sorry, it's 30 minutes. I will try to go over them in 10 minutes. So can we do left forward if we need to widen a bit more the maxillary, or after the cervix we need more expansion? And the answer is yes. After you do the SERB, if you have recession or so on, during the W surgery, you are able to open a little bit the bite. It's not like huge, because for this reason they do SERB before, when you need a lot of expansion. But if you need a little bit, they can do an open a little bit or whatever during the surgery. Also, I was worried because I thought my face was flatter on this side, but I think it looks like more symmetrical now. Then about the right side, my chin was a little bit protruded more to this side, and as I asked him if it would be solved, and they rotate a little bit more, like if it's more inclined back, so they can rotate and sort it out. With this forward movement, does the tongue move forward too? Yes. Will the jawline be more defined, like or horizontally? As you can see, yes, it changes. Mine was more like downwards, and now it's a little bit more horizontally. Then I don't want my chin wider, just shorter. It was thinking of the genioplasty, but yes, they measured the right proportions and try to balance it out. Anyway, I know some people who had genioplasty, and they are not happy now because it's a little bit projected, so they're gonna have them solved now. Also, am I gonna breathe better by my nose? Yes. And also septoplasty and turbinectomy. Is there a risk for a palate or jaw to recede? I already explained that. Will I have skin excess after you compact my upper jaw and do the genioplasty? Okay, so this is the thing I wanted to explain to you, because I know also this is the thing, like you speak to so many people, and on top you research a lot. And there was a girl, she told me that she realized she had skin excess after the surgery. She was like, okay, I don't have to worry now about my chin, but I do about skin excess, like falling a little bit. So when you push, in cases of class 3 jaw surgery, that they push a little bit the jaw backwards, this can happen. For this reason, for example, my surgeon, what they do is they push forward, never backwards, this jaw. Okay, so to solve the class 3 and have everything at the same height. Because yes, when you push backwards, you're gonna have this problem that the skin, you have a little bit of excess. But if you push forward, you have like lifting effect result, as they literally explained that to me. Actually, when I woke up from the anesthesia, I realized like my skin was very tight, and it felt very uncomfortable. Maybe it was mental a little bit, but yes, you feel it tight because, of course, they push, the bone push, and it gets a little bit more tight, the skin. So this is a solution, and for me, I would advise it, but you know your shit, and the specialists know better. And in my case, I didn't have skin excess. Yes, I realized that I am showing less my upper teeth, but I'm still swollen, but I don't feel skin excess. Then,